With about 10% of babies born as premature babies, we have Dr. A.G. Karthikeyan, a consultant neonatologist, Dr. Mehta's Children's Hospital with us to help us understand what is prematurity. Hello, doctor.
Hello.
What is prematurity?
Well, the normal pregnancy course is about 40 weeks. Once babies cross 37 weeks of pregnancy, we call them as term babies. So any baby born before the 37th week of pregnancy is termed as preterm babies.
How do we prepare for receiving a premature baby? Are there any special precautions or what is the steps?
Yes, receiving premature babies is a very anxious moment, not only for the parents but also for the medical team as well. But that is what we have been trained to do. It depends upon the degree of prematurity. As I mentioned earlier, any baby born before 37th week of pregnancy is termed as preterm babies. But the much more sicker ones are those who are born before the 34th week of pregnancy. And the very sick ones can be born before as early as 28 weeks of pregnancy, or in other words, before the 7th month of pregnancy. So these are the most sickest of the lot. To start with, we assemble a group of senior doctors and nurses who are well equipped to look after babies. So we go to the place where the baby is born, either in the labor room or in the operation theatre if there is a cesarean section. So we assemble all the equipment which is necessary for the stabilization of these babies. So most of these babies were born just over 34 to 37 weeks of the pregnancy, will require just basic neonatal care. When I say basic, what it involves is drying the baby very cleanly and providing some facial oxygen by means of oxygen tubing. But the sicker ones, those born before 34 weeks of pregnancy or below 28 weeks of pregnancy, may require more help. So these are babies who are very challenging. So these babies will require a lot of help with their breathing. For example, we could give them facial oxygen, or we could put a tube down their windpipe and give them oxygen through the windpipe by connecting them to a ventilator. We also have more advanced equipment called as CPAP, where we blow high amounts of oxygen into the baby's nose directly. So once this is done and we take care of the baby's lungs, we then concentrate on other systems like the baby's heart. We make sure that the heart is functioning well and the amount of oxygen reaching the baby's heart is adequate. We attach special monitors called as pulse oximeters to the baby's right hand in order to check the amount of oxygen which is present in the baby's blood. Apart from this, we will also be trying to stimulate the baby to breathe by giving various medications. And we keep checking the baby's heart rate. We keep checking the baby's heart rate at the first opportune moment. So once the baby is all stabilized in the labor room or in the theatre, then we use a special transport